Live from AARP. Embrace your health, beauty, and sex life during menopause. With your hosts, Barbara Hannah Grufferman and Dr. Margaret Nachtigall.
Hello, everyone. I'm Barbara Hannah Grufferman. I'm the author of Love Your Age and founder of Menopause Cheat Sheet, a weekly newsletter. Thank you for joining us for our third episode in our 5-part series focusing on all aspects of menopause. March is Women's History Month, and we thought that was the best time to talk about something that over half the world's population experiences. Now, AARP wanted to present this series of virtual events so that we can open up the discussion about a topic that is still considered taboo by way too many people, and we think that is crazy. Now, we know you're going to learn a lot from this series, but there are a few things we really want to make sure that you take away from this. 1, you are not alone. 2, your menopause journey is unique to you because we're all different, and so each one of us will experience menopause differently. 3, the vast majority of your symptoms can be addressed, but it's up to you to seek out the help that you need and deserve. And 4, everyone, this is not the end of your life. In fact, on the contrary, this is the beginning of a new stage in your life's journey. Now, this is a 5-part series, and we, as I said in episode number 3 tonight, there are 2 more coming up. March 24th, next week, we're going to be talking about how menopause affects our skin and hair, and holy moly, does it ever? Yes, it does. We'll have 2 great dermatologists to help us guide us through that. And then on March 31st, the last episode in this series, we're going to be taking a deep dive into how menopause really can impact our bone health, heart health, and brain health. And again, we'll have some incredible medical experts to help us and to give us the best tips to make sure that we age as successfully as we can. Now, today, we're going to be focusing on, first, vaginal health to find out what's going on and all the reasons why and some of the treatment options, too. And then we're going to segue over to talking about how these changes can impact our relationship to sex and maybe even how we have sex. And I have to tell you, our guest expert, who will be coming on a little bit later, will guide the conversation. And it will be open, we'll be honest. And if you see me getting a little pinker than usual, I can assure you it is not a hot flash. So, okay, let's get started. We want this to be a very interactive experience for all of us. There's a couple of things I want you to do. Just like in all the other episodes, we would like your questions. Now, I cannot get to all of them. You know that. I will try to get to as many as I can. And what I'll be doing, you will see me looking down from time to time at my cell phone, and I will be fielding your questions. And how you do that is if you're coming in from Zoom, go to the chat function and just put in your question. And if you're a live streaming from Facebook, the same thing, just put your questions into the comment section. So again, send us your questions. We want them and we'll try to get to them. Now, we're also going to be asking you some questions through some of the polls that we'll be doing throughout the show. So how do you do that? We really want you to participate. It's easy. Take a look at this video. So on your cell phone, go to the text function, to messages, okay? Then 22333 is what you put in. 22333. Then in the text box, you put in AARP, hit send, you'll get a response. There you go. And then you're all set. You only need to do this one time for the whole evening. I may have to repeat it a few times because some people might be joining in a little bit later. Okay, so now before I bring out my co-hosts, I would love to try a poll. So let's get started. So here's the first poll. Get out your phones, go 22333, AARP, and here's the question. Have you ever suffered from vaginal dryness? A is yes, B is no. Have you ever suffered or experienced vaginal dryness? A, yes. B, no. And now I'd like to bring out my co-host as you are putting in your answers. Dr. Margaret Nachtigall is a reproductive endocrinologist and a clinical associate professor at NYU Langone Health in New York City. She's also been in practice for over 25 years and is the medical director of Menopause Cheat Sheet. Dr. Margaret, always a pleasure.
Hi, Barbara. So excited to be here tonight. I'm very excited to talk about a really important topic, something that is very common, which is vaginal dryness. This is, without treatment, this really doesn't get better. So I think it's great that we're going to be addressing it today. Really, the majority of women will experience vaginal dryness. The statistic is that 50% of menopausal women have vaginal dryness, but only 25 seek help. But honestly, I think that it's more like 80 to 90% of women experience vaginal dryness. So we're going to hear all about it tonight.
Yes, and as we found out from doing a poll in our first episode, where we asked people, well, have you sought out treatment for the symptoms that you have because of menopause? The vast majority said no, they did not. So we're not surprised about that 25% number. And this is something I know that you want to address with everyone this evening and in every episode, to seek out that help if they really need it.
Exactly. That's one of our major goals.
Now, the thing with vaginal dryness, as you will go into more detail in a few minutes, is that it is something that when it starts out, it's uncomfortable. Okay, we got that. And too many women, though, think it's just going to go away all by itself, or this is just the way my life now is because I'm maybe over 45, over 50, or whatever she's feeling. And that really should not be the way women are feeling, because as you know, and you'll explain, vaginal dryness is something, if left untreated, can snowball into a much bigger medical condition and also have ramifications in other parts of a woman's life. How she views sex, whether she ever wants to have sex again, could really impede on her intimacy. So these are issues that have to be addressed, right, Dr. Margaret?
Absolutely. I completely agree with you. This is what we're talking about today. And I think it's really important that women get the help, individualize their care, and really move forward on it.
Okay, so let's take a look at and thank you. We're already getting some great questions in. We will get to them. Thank you. Keep them coming in on the chat. Yes, thank you. Let's get to the results of the first poll, shall we? So yes, clearly the vast majority, 78% said yes, 22% said no. We're not surprised about that, are we, Dr. Margaret?
This may be a group that has a higher number because of the title, and people might be more tuning in because they themselves have vaginal dryness, and so they want to hear more about it. But this is the number that I was expecting. I really believe that about 80 to 90% or 78% of postmenopausal women experience vaginal dryness. And so I think it's key that we address it. And I that's what I thought it was going to be.
Yes, we're not surprised. So good. Now, before we continue and I start asking questions to Dr. Margaret, let's hear from a viewer who wanted to share with all of us her own experience with vaginal dryness. Let's watch.
Okay. My experience with vaginal dryness, perimenopause compared to postmenopause. Perimenopausal symptoms or dryness were not as bad. When I became menopausal, it didn't happen overnight, but I started feeling drier. And if you've ever had a paper cut where you pulling that skin apart or ripping that skin apart continuously when you're having sex, it really, really was so painful. I can't describe it any other way. I just was really saddened that my sex life would be changing. And I used to watch the Golden Girls on TV, and they used to talk about sex all the time. So I didn't think that would or could ever happen to me, because you just don't think it happens to you, when you're in your 20s.
Perfect
That's
description.
Incredible.
That was exactly how I hear my patients discuss it all the time. I mean, perfect. She really was so eloquent and really did a great job of describing what it feels like to experience vaginal dryness.
Now, Dr. Margaret, before we bring on our special guest and we start our conversation about sex, explain to us, please, what exactly is going on. We know estrogen levels are dropping. How does that affect vaginas, and what is happening with vaginal health? Please explain.
I would like to, because that's the key thing, is that as estrogen levels decrease, that's when symptoms appear. So what estrogen actually does is it helps the collagen in the walls. Now, what does collagen do? Collagen is what maintains the thickness and the elasticity of the vagina. That means that it allows the vagina to stretch as it needs to do. In addition, estrogen helps a normal type of bacteria convert into lactic acid. And that keeps the pH of the vagina low, about 3.5 to 5. Not that I'm going to be testing you on this later, but that low pH helps keep other unwanted bacteria from appearing. So it decreases vaginal infections, and it actually even decreases urinary tract infections, keeping the pH so low. So all of these good things that estrogen does, you can see that when estrogen levels decrease, that's when we start to have the symptoms, because when estrogen decreases, that means less collagen. Less collagen means thinner and less stretchy or less elastic. In addition, if the estrogen is lower, the pH will go up. And when the pH goes up, as I mentioned, that's a time when we can get an increase of infection, either vaginally or urinary tract infection. And that's when we get the symptoms, which are itching, burning, can be pain on intercourse. These are really common. And just as you heard, people will describe them as our patient just did so beautifully, or I hear it feels like sandpaper. That's something I hear a lot. So burning, itching, and pain.
And but this can be really troubling for women with breast cancer too, because of certain medications, right? Can make have an effect on their. Don't they have a special issue? Is what I'm asking.
Right, because people with breast cancer, with estrogen receptor positive breast cancer, first of all, the medications that they take to lower estrogen can make the symptoms of vaginal dryness worse. And these are people that you often want to avoid using any estrogen products, so it's harder to treat. So that's a special group that is particularly challenging.
Yes, I'm sure. So, I mean, we are talking now about all the symptoms and what it can feel like. I mean, this is something that women really don't want to experience if they don't have to. I mean, we believe here no woman should ever have to suffer. So, how can vaginal dryness, A, can it be prevented? And I mean, A, can it be prevented? And B, how do you treat it? With what?
So, I mean, the first thing that I like to do, and I think I want to emphasize to everyone, is it's individual. There's no one treatment that's best for everybody. So I, again, would advise that you reach out to your doctor or your healthcare provider and discuss your symptoms, explain what is happening so that they can find the treatment that's best for you. Now, the first thing that we like to do when someone comes in with the symptoms of either itching or burning or pain and describing vaginal dryness is first make sure that we have the correct diagnosis, because sometimes there is another condition that could be causing the same symptoms, such as an infection, or very rarely a condition lichen sclerosis, which also causes some thinning of the wall, or even a cancer. So first thing we have to do is make sure we have the right diagnosis. Then once we have the diagnosis, we have some great options. So some people like to start with some over-the-counter products, something that is easy to use and easy to obtain. And those fall into a number of categories. First, we have those that lower the pH. So remember that estrogen lowers pH. So if we're not going to use estrogen, we might use a pH lowering agent like hyaluronic acid. Or we might use a moisturizer. A moisturizer, just like you moisturize your skin, you can moisturize the inside of the vagina. Now, some moisturizers actually also lower pH. But a moisturizer is inserted vaginally and it keeps the walls moist. Or some people choose to use just a lubricant, and a lubricant would be used instead of using it, say, every single day, it might be used just prior to having intercourse. And that works because it decreases the friction, and that can be very helpful. And then there's also another non-hormonal option would be laser treatment. Laser is very expensive, but it is helpful for some people, especially those that can't use hormonal treatment. So then we move into the treatments that are hormonally based. And the one that works probably the best of all is estrogen. And remember, this is being given, I'm talking specifically about a local estrogen. We are using micro doses. Tiny amount of estrogen that's used in the vagina. So just locally. Now, if we're using it locally, it almost never gets absorbed. Sometimes there is some absorption. For the most part, it's a very, very tiny amount that gets absorbed into the system. So there are tablets, there's creams, there are vaginal rings that we can use that contain estrogen that can be extremely helpful in treating vaginal dryness. And then there are other hormonal agents that don't have estrogen in them. For instance, there's a long name which is abbreviated as DHEA, which is actually, once it's inserted into the vagina, so it's not estrogen, but when it's inserted into the vagina, it can convert into some estrogen, and that can also be really helpful in decreasing vaginal dryness. So there's also some oral treatments, and some women that are on estrogen, systemically, meaning all over the body, that can also be effective treatment for vaginal dryness. So there are a lot of treatments. Again, best thing is seek your healthcare provider and talk about your own needs and see what's best for you. But don't go untreated.
Here's one question, Dr. Margaret. So if someone's menopause symptoms are like the typical ones, like a hot flash, have already subsided or really mild, but they have severe vaginal dryness, what is the better option if they can take systemic hormone treatment, HT? Would it be a topical, local estrogen, or would it be systemic? Which one works better for vaginal dryness?
Well, I think it's individual. I think one of the advantages of a local treatment is when we're starting hormone therapy systemically for the whole body, if we're taking it by mouth in a patch, something like that. Remember, we want to do that close to the time of menopause, so within the first 5 years and certainly within the first 10 years. If we have an individual that presents to us with vaginal dryness, but is, say, 10 years or 15 years from their last period and has not had exposure to any estrogen, we wouldn't want to start something systemic. And so a local treatment would be ideal. And for some people, local does work better. And I have to say, in many cases, I actually do both. I give a systemic hormone therapy. That might not be enough for the vaginal dryness. And so I'll be able to maintain a very low dose systemically, and I add a little bit of vaginal estrogen.
Okay, Dr. Margaret, we are going to move on. We're going to switch gears. We're going to talk about sex. But before we bring in our guest expert, we do want to have another poll. So please go back to your phones, 22333, type in AARP, hit send, and you'll be all set to respond. Now, this is a word cloud. If you guys have been with us before, you know that you don't put in A, B, C, or D response. It's a word. And here is the question. What is the first word that comes to your mind when I say the word sex? So again, go 22333, type in AARP, hit send, you'll get a reply, and then please put in your response. So the word sex, what is the first word that comes to your mind? Give it to us. And now, as you're inputting your responses, we would like to bring on our very special guest. Oh, we're so excited about this. Dr. Laurie Mintz is an award-winning author and sex therapist and a professor of psychology at the University of Florida. She has published many research studies and has won numerous awards, teaching awards, professional awards, and is a fellow of the American Psychological Association. She's also the publisher of 2 extremely popular books which have helped women around the world to enjoy sex more, really embrace their sexuality. One is called Becoming Clitorate, Why Orgasm Equality Matters and How to Get It. And the other is A Tired Woman's Guide to Passionate Sex, Reclaim Your Desire and Reignite Your Relationship. You can follow Dr. Mintz on Facebook, Twitter, Instagram, and if you haven't yet seen her TED Talk about all this, right after the show, Run, Don't Walk, and check it out. Hello, Dr. Laurie.
Hello, I'm so excited to be here.
We're
really
so
happy to have
excited.
you.
We're so excited. Before we get the questions going, because we have a lot of ground to cover, let's take a look at the results of our word cloud. Dr. Laurie, we asked people to please give us the word that comes to mind when I said the word sex, and here we go. Well, we see what words are coming out. Pain, pain, painful, pleasure.
I predict that pain would be our number one, I have to say. I'm glad that pleasure is a close second.
Yes, a lot of words came out, though. A lot of words came out. So this is great. Well, I'd like to spend more time looking at that later. But Dr. Laurie, let's get right to you. The first question. Okay, so why should we care so much about sex anyway? I mean, we're devoting half of this show to sex and talking about sex. Why should we care? I mean, if a woman is uncomfortable or just, I don't know, why should it matter so much?
Okay, well, before I even answer that, let me take a step back and make sure we're all defining sex similarly. In our culture, we tend to use the word sex and intercourse as if they are one and the same. And for tonight, I especially, in general, and especially tonight, when we talk about sex, I want you to think about the entire sexual encounter and not just intercourse. And the reason is because we know that the overwhelming majority of women don't orgasm from intercourse alone. And we also know that intercourse is what becomes painful with vaginal dryness. So when I say the word sex, it's the whole encounter, and I'll use the word intercourse when I mean intercourse. So why is sex important? It has physical, emotional, and relational benefits. I know Dr. Margaret will speak to and can speak to the benefits of vaginal health physically. But before she does that, let me talk about some of the more emotional and relational benefits. Sex makes you feel sleepy, and a lot of us are suffering from insomnia. It releases some really feel-good chemicals that make you feel much more at peace, relaxed, happy. We also know that it is the oil and glue that holds relationships together. What do I mean by that? So many times, if couples give up sex, they become roommates, life partners, and they are missing what is defining often for a committed relationship, which is sex. And we know that couples who have sex have better satisfaction in their relationship. They feel closer to their partner. They laugh more. I've had so many women say to me, I find my partner a lot less annoying after a sexual encounter. So it's true for me. So really, sex has physical, so many. This is the tip of the iceberg, but it is really a very important part of emotional and relational health and physical health, as I'm sure Dr. Margaret will tell us.
Thank you for that. I think you're a real, you're pro-sex, no doubt about it. Dr. Margaret, orgasms actually are good for us health-wise. Explain, please.
Well, they do increase, orgasm helps increase blood flow to the vagina. So it helps bring back the blood flow, which allows for vaginal health. So that's one advantage. Another is during intercourse, in penile vaginal intercourse, that will allow for the stretching and practice stretching. So that's an advantage to keep the health of the vagina around.
Dr. Laurie, I have a question from someone in the audience, from Pamela. Thank you, Pamela. Does a woman's sex drive slow up as she's going through menopause? I think we've established certainly it does, but would you address that, please?
Well, so by sex drive, and that's another thing I have to define before I talk about it, we often think about sex drive as our innate feeling of horniness, wanting to have sex. And there's another aspect of our sex drive. It's not physical, it's in our head. Am I receptive to the idea of sex? Do I like the idea of sex? And it's all kind of complicated. And a lot of times for menopausal women, their sex drive, their interest in sex goes down because they're not sleeping, they're having hot flashes. If sex hurts because of pain, we know who wants to do something painful, so the drive will decrease. However, this, just like Dr. Margaret said, everything is individual. Not every menopausal woman has a decrease in sex drive. And in fact, there's some interesting research that menopausal women with a new sex partner have a very high sex drive, which makes us think about, when we're talking about sex drive, are you tired of the sex you're having, and how can you make it a little more interesting? So there's no one size fits all, but yes, that lost desire, diminished desire is the number one complaint that women bring to sex therapists. And part of it's due to menopause, but some of it's also due to life stress as well.
Absolutely. Life stress. I mean, worrying about aging parents, worrying about your children still. There's a lot of going on in life that could really kind of impose itself on your interest in sex. But also, you brought up something very interesting, is that very often women who are going through menopause are of an age where maybe they've been with the same partner, maybe married for 20, 30 years, which is very possible. So a little bit of boredom could be setting in. And that is something. So we're talking about reinventing sex. So it's not really just because of physical changes, but also because of just like add a little bit more fire into the bedroom, right?
Yes.
Okay,
absolutely.
Dr. Laurie, we have another. Absolutely. Dr. Laurie, there are a lot of people tuning in who may not be with a partner. AARP actually came out with a study a few years ago that said about 50% of people over 50 are single, whether by choice or circumstance. So there are some people out there who okay, I have an interest in sex, but I don't have anyone to have sex with. So what do you want to tell them?
Have sex with yourself. You can be your own favorite lover. And all those benefits of sex that I spoke about earlier, they actually also apply to a person pleasuring themselves. An orgasm will flood you with feel-good chemicals. You will sleep better. You will feel more peaceful, more relaxed. Your vaginal health will be better. And it is really, really important. And in fact, all sex therapists recommend self-pleasure, whether you have a partner or not. And I'm a huge, huge advocate of self-pleasure. So lay down, enjoy the time with yourself.
I do have one audience question, Dr. Laurie. Anita wants to know, do we get the same benefits of sex I guess all the benefits, health and otherwise, with masturbation as well as using a sex toy like a dildo?
I'm so glad that you asked about, yes, an orgasm is an orgasm and is an orgasm, regardless of if you give it to yourself or you experience it with a partner. So an orgasm, no matter how you get it, is going to flood you with feel-good chemicals that will give you those physical, emotional, and health benefits. And in terms of how to pleasure yourself, here's a really interesting statistic. You use the term dildo, which is a sex toy that's inserted vaginally. However, here's what we know about when women pleasure themselves. Less than 1% do so by inserting something exclusively in their vagina. The rest do use clitoral stimulation, the other 99%, sometimes alone or sometimes coupled with penetration. And we know that clitorises respond incredibly well to vibration, and that we know that women who use clitoral vibrators, external clitoral vibrators, or one with an attachment that goes inside if you like that, have easier and more frequent orgasms. So I highly recommend vibrators as a part of both an individual and a couple's sex life.
Thank you, Dr. Laurie. And Louisa sent a great question, which I think just is perfect for what you were just saying. And she says, I haven't had a sex with a partner in 5 years. It now takes a very long time to reach orgasm for me. I'm 51. Is there a way to get there faster? I'm allergic to silicone, so the vibrator option is challenging. Any thoughts on that?
Okay, well, we do know, and I'm sure Dr. Margaret can also speak to that as we age, we often need more intense and more specific targeted stimulation. So taking too long, I hear that a lot. And the first thing I would say is take all the time in the world that you need. And if you are focusing on it's taking too long, you're not going to be really mindful or having your head and body in the same place and experiencing that pleasure. So I would like to ask you to just take a little, pressure off how long it's taking. I would also say there are vibrators out there that are not made of silicone that you can purchase, and that might help. And there's some vibrators that use air technology. The Womanizer is one, Lilo has two, and you don't even have to touch yourself with it. You hold it above your clitoris, and the air kind of comes out and it stimulates. So I would recommend experimenting with those types of things.
Thank you, Louise. I hope that you've been taking notes on that. I'm sorry, Dr. Margaret, go ahead.
Well, I was just going to say, what I'm hearing from you and what we've been talking about is that it's so multifactorial. And that really comes back to what you were talking about, libido, which is so multifactorial. And I think that some of it can be the changes in the hormone levels, the lowering of the estrogen and often a lowering of testosterone as well. And I think that plays a role, often adding something vaginally, some kind of hormonal improvement, or even the over-the-counter non-hormonal agents can sometimes improve and make the orgasm easier.
Mm-hmm. Absolutely.
Okay, so we have a lot of questions to get to, so let's move on. I would like for everyone to hear again from our viewer who you met earlier in the show. She had trouble talking with her husband about her issue with vaginal dryness, but let her explain. Let's watch.
It did get worse, though. My sex life declined since post-menopause, but I am working on it. We both are working on it. He's not 20 either. I did talk to him about it. I didn't feel good. I really told him that he was hurting me. And my husband happens to be a very understanding man, and he was always so sweet. So it did it did affect my sex life afterwards. And it just changed a lot. for me. Like the frequency was less. I wasn't looking forward to it. I made it, not excuses, but I would tell him, no, I don't want to, it hurts. But it's a work in progress. I haven't reinvented myself yet. I'm working on it. I think it's going to be okay, too.
So honest. And clearly, she has taken that bull by the horns, and she did discuss it with her husband, brought him into the conversation, which is going to make their sex lives together and their intimacy a lot better, a lot stronger. But what about women who just aren't comfortable? They're just not there yet. And so what are they doing? They're putting sex on the back burner. And then, it's just creating an intimacy issue. So what advice do you have for them on how they can bring this up with their partner?
Well, I think sexual
Dr.
communication. Laurie. Okay, thank you. First of all, people are afraid to talk about sex. We're raised to be very secretive about it. So I really do empathize with how hard it is. However, what I always tell my clients is that I promise you, it is so much easier to learn to talk about sex than to hope your partner reads your mind or that you can read theirs. We also know that couples who talk about sex do have better sex. And brace yourself, have that conversation. And here's how I recommend doing it outside of the bedroom, what I call a kitchen table sex talk, using really good communication skills where you say something like, using I statements and loving statements, I really love you. I really love our relationship. Sex is an important part of this. And I have something I'm nervous about talking to you about, but I'm doing it because I love you and I want us to be the best we can be. I'm having vaginal dryness, which I learned is very common for women in my age, and intercourse is hurting. And I am going to be seeing a doctor to work on that medically, but I need us to be able to talk about that and what we do about that during our sexual encounters. And that's just a way to open the conversation, but have a conversation about sex at a time where you feel ready, where you have time outside of the bedroom. Own your feelings with I statements, and I can't promise you how it goes. I don't know you all. I don't know your partners, but I have seen the overwhelming majority of these conversations go incredibly well. Incredibly well.
I don't think that sexual partners want to be left out of what's going on. I mean, don't you think that maybe the other person could start to feel, oh, it must be me, which is a dangerous place to be? Dr. Margaret, you wanted to say something?
I was going to say what you were going to say, Barbara, and it's I think that those that have partners, that the partners are appreciative of the conversation and the communication, and in fact, many men in the same age group have experienced erectile dysfunction. Somewhere about 30% of men aged 40 to 70 will have had erectile dysfunction. And so this is a great opportunity for them to open up and discuss what is the issue there. And some of the erectile dysfunction is caused by a fear of eliciting pain in their partner. So I think that conversation is critical, and just as you said, figuring out how to make it work for the participants.
Okay, everyone, we have another poll question. And so if you remember, go to your phone, 22333. If you haven't done that already, type in AARP and you'll get a response. You can give us your responses to my question, which is, did you experience pain the last time you had intercourse? A is yes, B is no, C, I don't have intercourse. A, yes, B, no, C, I don't have intercourse. Okay, Dr. Laurie, we have another question. And in fact, a few questions from the audience came in. So I'm going to put them all together actually into one question. Talk to us about diminished desire. Okay, you just like you're not there. It may be because of vaginal dryness, but your head's just not there. What can they do about that?
I love this question. And I'm so glad we're talking about this because I said diminished desire is the number one complaint that sex therapists get. So again, remember there's two types of desire. One, I don't feel horny. And two, that's called spontaneous desire. That's the only one we usually learn about. But there's another kind of desire called receptive desire. I am receptive to the idea of sex because I know I'll feel closer to my partner. I'll feel better after. And a lot of times when people say they lost their desire, they lost their physical feeling of desire. Here's something really interesting. We know that all women lose their physical feelings of desire about 2 years into a relationship. The limerence phase, it's called, is over because that early sexuality is so exciting and you want to feel that way. But think about it. You couldn't raise kids, have a job, care for your aging parents if you're in that state. So we know that changes. So what do we do about it? Two things. Stop trying to feel the way you used to feel. I can't tell you how many times I hear that. And my answer is stop trying to feel the way you did. It was lovely, but no, now it's time to that doesn't last for more than 2 years for anyone. And it's time to reinvent sex for now. So what do? Use that receptive desire. Have sex, and I mean broadly, to get horny rather than waiting to be horny to have sex. And to do that, I strongly suggest scheduled sex dates. That doesn't sound romantic, but they're very romantic. I call them trysts, a planned meeting between lovers. And what that does is it takes away all that tension. Are we going to do it tonight? I don't want to do it tonight. He wants to do it tonight. She wants to do it tonight. And you know when it's going to happen. And then you can let the sexual activity lead you to arousal and desire. You can do some things to jumpstart that if you want. Novelty, reading an erotic fiction, lots of things. But I have a lot of clients who say, oh, it's fun when it gets going. And I say we should do it more often, and then I don't. If it's fun when it gets going, that is great. So what you need to do is think of it like a car in the wintertime. It might take a little bit to get going, but you can have a lovely drive. So that's my biggest advice is use your receptive desire and schedule sex dates.
That's a great takeaway. So the best sex is planned sex, not spontaneous sex. Like forget about that whole idea of spontaneous sex. Dr. Margaret, did you have something you wanted to add to this?
I mean, I bring back the hormones again. I think if the desire has really declined, I love all of the suggestions, and I've just learned a lot from you, Dr. Laurie. But I think it could be a time to get your thyroid checked, go to see your doctor, see if there is a hormonal change that could be helped. But I would go with everything you're saying. I'm learning from it. I'm going to use it when patients
Wonderful.
bring that to me.
Wonderful.
I have a great question from an audience. Julie, thank you very much, Julie. Okay, so here's a question, Dr. Laurie. How can you get your husband to understand? How can I get my husband to understand that sex does not have to involve penetration? It doesn't have to just be about intercourse. I have had the conversations. I do the estrogen and everything I'm supposed to be doing. He is so stubborn. What can I do? Dr. Laurie, any tips for her? I mean, I think that this should apply to a lot of women.
Yes. And I think this is a big, big issue that because in our culture, we use the word sex and intercourse as if they're the same, foreplay as if it's just a lead up. And it's a very tough conversation for some men who get their self-worth through this sometimes even and think they're supposed to give a woman an orgasm through penetration, which again, only 4 to 20% can. And it sounds to me like this listener has talked and talked and talked, and her husband's not getting the memo. And so in this case, it sounds like it might be something that a therapist could help explain. There's some books out there that help explain this that you could suggest to your husband to read. My own book, Becoming Clitorate, has a section for men to read that talks exactly about this. There's a book by Ian Kerner called She Comes First, which also talks about this, and a man wrote it, so it could be even better. But if you've had the conversation, you've suggested the books, nothing's working, might be time for a few sessions of couples therapy with a knowledgeable sex therapist. And you can find one on the American Association of Sex Therapists, Counselors, and Educators, AASECT, AASECT. There's a Find a Provider link where you can find certified sex therapists by state and even outside of the U.S. by many countries.
That's
Dr. Laurie,
idea.
what if a couple hasn't had sex in a really, really long time? Like, vaginal dryness has popped up and they just put it on the back burner. It's just not been happening and time goes on. And now they're living, as you described earlier, like roommates and not lovers. What advice can you give to them to get started again?
Absolutely. There is something called sensate focus, and it's a really great technique. Let me tell you what it is, and you can kind of mimic it yourself or see a sex therapist to help you guide through it. If you haven't had sex in a very long time, it is not realistic to think you're just going to hop in the bed and it's all going to work. You need to build up slowly. You need to add erotic and sensual touch back into your life. So start by kissing. Remember how erotic making out in your parents' driveway was when you couldn't go all the way? That made it even more exciting, right? And then we get to this stage where we either don't have it or we hop in bed with no touch at all day, and then say, do we want to? Of course we don't want to. So start adding in erotic touch, little, kisses, hugs, hand on the thigh, making out at times when sex is impossible. And then start slow. Have a makeout session. Sometimes I have people put the timer on, give each other massages, 5 minutes for you, 5 minutes for me. Then there's something, so this is building up to it. But the best thing, I think, for a couple in this situation is to see a certified sex therapist who can guide you through these sensate focus exercises where you actually say sex is prohibited. And then the therapist takes you through step by step, incrementally rediscovering your erotic connection.
Thank you, Dr. Laurie. Okay, let's get to the results of that last poll, shall we? And we asked you, were you uncomfortable? Did you feel pain the last time you had intercourse? And 46% said yes, 39% said no, and 15% said I don't have intercourse. So, okay, more said yes, more were uncomfortable, and that's good information. Okay, now everyone, we are going to get to more of your questions for Dr. Laurie and Dr. Margaret. And before that, AARP wants you to know about some e-newsletters that they created for women just like you. Take a look.
The Girlfriend champions female friendship, especially as we age, and is a community of mostly Gen X women. We offer the best in health, sex, beauty, travel, career, and parenting information. The Girlfriend also offers an active online book club as well as regular live events. Go to thegirlfriend.com. Sisters from AARP celebrates Black women and welcomes all women. We cover a wide range of topics, including health and wellness, work and money, entertainment, live events, beauty, faith, and more. Go to sistersletter.com. And the Ethel from AARP. The Ethel is a community of women smashing stereotypes around aging and celebrating life at every age. The newsletter offers older women the best in health, sex, relationships, finance, and lifestyle information. The Ethel is named after Dr. Ethel Percy Andrus, AARP's founder, who fought tirelessly for the rights of older Americans. Go to aarpethel.com. Subscribing is free and easy. Check them out now.
Okay, everyone, we can't get to everyone's questions, but we're going to try to get to as many as we can right now. And these questions are for both of you, Dr. Margaret and Dr. Laurie. Dr. Margaret, this one is for you. Jennifer wants to know, would collagen supplements help with this issue?
Interesting. Collagen can help with the thickness and the elasticity, but it won't take away the surface of the surface discomfort or change the pH necessarily. But that is an interesting option.
Okay, and Dr. I'm going to start with Dr. Laurie, but this is a question really for maybe both of you. Karen wants to know, if my husband's penis fit into my vagina years ago quite well, okay, it's like no problem, no pain, but now there is, will it likely fit again if I get vaginal support through cream or other treatment? In other words, really what she's asking is, will the pain and discomfort stop once I get treatment? I mean, that's what I'm hearing. Maybe Dr. Margaret, can you
I'll
answer?
Start, then I'm going to send it over to you, Dr. Laurie. I think that makes me really realize that what I should have said earlier is that the sooner that you start treating, the better, because as vaginal dryness continues and the elasticity decreases, there actually can be a narrowing of the vagina. And sometimes it's difficult to get the narrowing to get wider without using some supplemental help, as in a dilator, if it's gotten that far along. But the treatments that I discussed before, those that are going to decrease the pH, a moisturizer, a lubricant, as well as hormonal, local estrogen, can be extremely, extremely helpful. And I have had many patients who have come in with very narrow, almost non-existent openings to the vagina, that we've done what I call vaginal rejuvenation. But what I really mean is just really bringing the vagina back to its original state and try to get as functional as possible. And I've seen remarkable changes with the treatments that we discussed before. Really can be helpful.
Do you want to? Yeah, no, that's great. Karen, I hope that you just got your answer. I think there is very good news for you on the horizon for you and your husband. Dr. Laurie, did you want to add anything to that?
No, I was going to recommend the exact same thing, like making sure there's treatment. And then those dilators, you can get them on Amazon. You can also see a pelvic floor physical therapist who can guide you through how to use the dilators, or your healthcare provider. And some of them, you slowly increase the size using lubricant, giving yourself a massage, basically. And there's even dilators that vibrate that can be helpful in the tissue regeneration as well. So I'd say see your healthcare provider, get the dilators, work slowly with yourself. And also for this, pelvic floor physical therapy can be extremely, extremely helpful, even if just to show you how to do the dilators and how to do sort of your own internal massage to stretch yourself a little bit. But yes, there is hope.
And I'm very optimistic that you will be able to be helped.
Especially with the guidance that both of our doctors just gave our audience. Thank you so much. This really was an incredible conversation. Thank you, Dr. Margaret, for kind of laying the groundwork and explaining why these changes are happening to our bodies. And of course, Dr. Laurie explaining what we can do once we do go through these changes to either reignite our sex lives, think about it differently. I hope that you all are kind of rethinking your relationship to sex. It's an important part of life. It can bring joy. It actually brings better health, as both doctors pointed out. So it is something that should be a priority in your life. And hopefully we helped you here tonight. And again, we will continue to have these conversations for the next few Wednesdays in the month of March. So please mark your calendar, 7 p.m. every Wednesday night. Dr. Margaret, I believe you have a few takeaways that you want the audience to hear for tonight.
Well, I think we had a great conversation. I think that the takeaways from what I was describing is that, one, a lack of estrogen in the vagina leads to symptoms of vaginal dryness, such as decreased elasticity, burning, itching, pain, and that vaginal dryness or vaginal atrophy can be treated, and treatment should be begun early. But even if it's not, it's helped with non-hormonal as well as hormonal options. So go seek attention and get advice from your healthcare provider. And
thank you for those takeaways. And Dr. Laurie, I know that you have a takeaway for us as well.
Yeah, so I would concur, seek treatment because sexual problems are solvable and sex is free, it's fun, and it's good for you.
Yes, it is. This was
advice.
So much fun. Thank you. Thank you so much, Dr. Laurie, for joining us. I hope that we'll all gather together again to continue this conversation. There never is enough time to cover everything and to answer all the questions that we got tonight. Thank you so much for joining us. And again, we're going to continue the conversation. We're going to continue the conversation next week. And there's a few things that we want you to know. Next week, we're going to have Dr. Janine Downey and also Dr. Doris Day. You may have seen both of these dermatologists on all the morning talk shows and in a lot of magazines. You really won't want to miss what they have to say about how menopause really impacts our skin and our hair, with a little focus on hair loss, which is a pretty common thing for postmenopausal women. So definitely tune in next week on that. And for more resources, more information about menopause, you can go to thegirlfriend.com/menopause.
And I also would love to thank you for all listening and for the surveys that you have filled out. We really, really value your opinion. So please, if you have just a few minutes to fill out the surveys, that would really be great.
Margaret, it was great to see you. See you next
Barbara,
week. Looking forward,
so good
as always.
To see you. Always fun to be with you. Can't wait to do it again next week. Thanks,
See
Barbara.
you next week. And everyone, we're really looking forward to seeing you again next week, too. Until then, remember this: we can't control getting older, but we can control how we do it. Good night, everyone.